Hi friends, good evening and welcome to my channel Mookambika Nursing. Friends, in this video we can discuss important and previous year questions for exam preparation. We can see the questions. Which diet should be avoided in acute renal failure disease? Option A carbohydrate, option B protein, option C fat, option D vitamin. Acute renal failure means is the rapid loss of kidney function from renal cell damage. Okay, that is acute renal failure. So the diet should be avoided in acute renal failure is protein diet. Option B is the correct answer. The dietary advice for the patient with renal failure, acute renal failure is moderate to low protein diet, that is about 30 to 50 gram per day. So protein should be low to moderate. This is because to decrease the workload on kidney. The patient should take moderate to low protein diet, that is about 30 to 50 gram per day. This is protein, and should take high carbohydrate diet, that is about 300 to 400 gram per day, and moderate fat diet. Fat should be 70 to 90 gram per day, and restrict potassium and sodium intake based on the serum electrolyte level. And the next question, which gas is most commonly used in laparoscopic surgery? Options: option A nitrogen, option B carbon dioxide, option C oxygen, option D hydrogen. The gas most commonly used in laparoscopic surgery is carbon dioxide. Option B is the correct answer. Move on to the next question. HPV vaccination is given to protect against. Options: option A cervical cancer, option B breast cancer, option C squamous cell carcinoma, option D lung cancer. And the correct answer is option A cervical cancer, HPV vaccination. HPV means human papilloma virus vaccination is given to protect against cervical cancer. Human papilloma virus is the most common cause of cervical cancer. Okay, and the vaccination is given to adolescent girls 11 to 13 years of age. Vaccination is HPV vaccination. It is given 11 to 13 years of age. And pap smear is the screening test used to diagnose cervical cancer. Move on to the next question. Most common type of episiotomy is. Options: option A lateral, option B mediolateral, option C J-shaped, option D median. Most common type of episiotomy is mediolateral. Option B is the correct answer. Episiotomy means is an incision made into the perineum to enlarge the vaginal outlet and to facilitate delivery. So it is usually done in the perineum. It is mainly helps to enlarge the vaginal opening, and thereby it helps to delivery of the baby. Okay, so the most common episiotomy is mediolateral episiotomy because it has less chance of bleeding and laceration. Usually the episiotomy is performed during the second stage of labor, pushing stage of labor, second stage. Okay, here the most common type of episiotomy is mediolateral episiotomy. And the next question, exclusive breastfeeding continued up to. Options: option A 3 month, option B 6 month, option C 9 month, option D 12 month. Exclusive breastfeeding means the baby should take only mother's milk. Okay, it should be continued up to 3 months. Option B is the correct answer. Then afterwards we can slowly start weaning. So exclusive breastfeeding continued up to 3 months. Option B is the correct answer. And the next question. Before birth, the alveoli in the baby's lung are expanded and filled with. Options: option A air, option B fluid, option C blood, option D meconium. And the correct answer is option B fluid. So before the birth of a baby, the alveoli, lung alveoli is filled with, expanded and filled with the fluids. Okay, option B is the correct answer. And the next question, the golden minutes in neonatal resuscitation refers to the first. Option A 10 minutes, option B first 60 seconds, option C first 15 minutes, option D first 5 minutes. And the correct answer is first 60 seconds or first 1 minute. Okay, the golden minutes in neonatal resuscitation. So immediately we have to do the necessary things within 1 minute. For that is the golden minute of neonatal resuscitation. And the next question, a deposition of food and bacteria on the teeth which may cause dental caries are known as. Options, option A gingivitis, option B xerostomia, option C plaque, option D stomatitis. And the correct answer is option C plaque. A deposition of food and bacteria on the teeth which may cause dental caries, that is known as plaque. And the second option xerostomia means dryness in the mouth. And first option gingivitis. Gingivitis means inflammation of the gums. Stomatitis, option D, is the inflammation of mucous membrane of the mouth. Okay, inflammation of the gums is gingivitis. Inflammation of mucous membrane of the mouth is stomatitis. And the next question, an inflammation state of the upper female genital tract and nearby structures is called. Options, option A vaginitis, option B pelvic inflammatory disease, option C gonorrhea, option D urethritis. And the correct answer is it is pelvic inflammatory disease, that is inflammation of upper female genital tract and nearby structures is known as pelvic inflammatory disease. Option B is the correct answer. And the next question, mousy odor of urine is seen in which disease? Option A tyrosinemia, option B phenylketonuria, option C jaundice, option D galactosemia. And the correct answer is it is phenylketonuria. Option B is the correct answer. Mousy or musky odor of the urine is seen in phenylketonuria. Phenylketonuria is an autosomal recessive inborn errors of metabolism. So that disease which is occurs by birth and result from a deficiency of phenylalanine hydroxylase. So the children with phenylketonuria are unable to break down the amino acid phenylalanine. Okay, which may result in mousy odor or musky odor of urine. Move on to the next question. Ferric chloride test is used to diagnose. Options, option A phenylketonuria, option B alkaptonuria, option C albinism, option D cystinuria. Ferric chloride test is used to diagnose phenylketonuria. Option A is the correct answer. In phenylketonuria, the test is positive means urine color will be green. So the urine color green indicate phenylketonuria, that is ferric chloride test is used to diagnose phenylketonuria. Move on to the next question. Which is the high phenylalanine diet? Options, option A meat and dairy product, option B rice, option C fruits, option D all of this. Among this, which is rich high phenylalanine? And the correct answer is it is meat and dairy product. Option A is the correct answer. Phenylalanine rich diet include meat, fish, chicken, egg, dairy products, beans, nuts, legumes, colas. These all contain high amount of phenylalanine. And the diet with vegetables, fruits, cereals, juices are low phenylalanine diet. So the patient with phenylketonuria should avoid high amount of phenylalanine diet. So here today we discussed important previous year questions for exam preparation. Surely these questions will helpful for your studies. If it is useful for your studies, please subscribe my channel and share my videos to your friend circle. Thank you for watching. We can see the next set of questions in next video.